Okay, so let's talk about osmotic demyelination syndrome, which usually talks about acute demyelination in the setting of osmotic changes, typically because of rapid correction of hyponatremia. Usually patients that are malnutritioned, like alcoholists, like people with lung diseases, chronic lung diseases, liver transplant patients, those patients that are malnutrition, that has hyponatremia, that we correct too rapidly, we can do osmotic changes that disrupt the blood-brain barrier, cause cell damage and release of extracellular toxin, which cause damage to the myelin. Therefore, demyelination, therefore the name osmotic, because of the change of osmolarity, demyelination, damage to the myelin, and its syndrome. Now, osmotic demyelination in presentation, it has biphasic pattern. The first phase, as you can see, is usually not to the demyelination, but because of the electrolyte abnormalities, usually encephalopathic patients, so mental status changes. And the next phase, after they improve, so we see pontine involvement, which causes spastic quadriparesis, pseudobulbar palsy, altered consciousness state, coma, and death. So when we're talking about the treatment, after it's occurred, then we just support. We need to prevent it by not correcting too rapidly hyponatremia. Now, when we are looking at imaging, the other name for osmotic demyelination is central pontine myelinolysis, because most of the time, as you can see, there is involvement of the pons in the brainstem. But it's not always in the pons, because 50% of the cases has extra pontine involvement, but you need to remember the involvement of the pons, therefore the name central pontine myelinolysis, the second name for osmotic demyelination. You can see sometimes hyperintensity signals in the pons, that's always, but also sometimes, like this one, extra pontine areas. We are talking about the thalamus, the basal ganglia, the hemispheric white matter, which is usually symmetric, but don't forget the pons. So this is about osmotic demyelination, what is also called central pontine myelinolysis for a reason. Thank you very much, and that's it, and thanks for Wikipedia.